Welcome back to Aspirations, career advice for your life. I'm your host, Mina Sleeb, joined by my co-host, Marina Barsoum. We're sitting today with another professional, Dr. Marina Barsoum. Dr. Barsoum is a hematology-oncology clinical pharmacist, and we're very excited to learn more about the field of pharmacy today with her. Thank you very much for being here.
Thank you for having me. So when I was in high school, I worked at a pharmacy as a technician, and I realized that I really liked helping patients with their medications without really needing to go through the diagnosis and all the investigative work. And I really wanted to be a doctor originally, but knowing all the years that they go through, I said, no, thank you. So I decided that I wanted to do pharmacy and work alongside the doctors. Specifically, what got me into hem-onc is we actually had a friend during my fourth year of pharmacy school that came and had cancer, and just seeing how the clinical pharmacist at the hospital she was getting treated at really helped, and the level of care that really gave me a passion. And then I explored it more, and I decided that this is what I wanted to do.
That's awesome. What was the pathway to get into your field?
Sure. So the pathway to get into pharmacy, if you do a program, it should be a 6-year program where you graduate with your doctorate degree at the end of that program. If you don't do a program, you will do 2 years undergrad, take your PCAT, which is kind of equivalent to the MCAT, but for pharmacy, and then do 4 years of graduate school. Yes. So after you finish your 6 years, you're at that point you're a pharmacist, so you can work at like a CVS, a retail pharmacy at that point. However, to specialize, you need to do 2 extra years. So you do 2 years in a hospital, 1 year general, 1 year as a specialty. And the other route you can go into is pharmaceuticals. So you would do 2 years of a fellowship instead of a residency, and then work in a pharmaceutical company.
Awesome. And on average, how much does a student graduate with loans?
So the loans are pretty hefty because most of the programs are private schools that offer it. So you could graduate with anywhere from like $150 to $250 in loans. If you do a longer route, it could be more. If you do a city or SUNY route, it will be cheaper. But on average, about, I would say, $100 to $200. Sure. So in retail, which I'm sure everyone has seen your pharmacist at a local retail pharmacy. So a lot of it is dispensing medications, making sure that there's no drug-drug interactions between the medications that you're on. And if you have time, counseling patients, giving vaccines, just doing that day-to-day operations for patients. On the hospital side, so what I do, I actually don't touch any medications. So I'm not mixing anything. I'm not dispensing anything. My role is I round with the oncologist. So it's really a team-based approach. So since we're giving toxic chemotherapy, my goal is to review the chemotherapy, review the patient's profile, and make sure that all their toxicities are managed, as well as the patient is educated on their therapy.
Do you believe that you have to be passionate about your career/job?
100%. I think especially for hem-onc, you have to be really passionate because it really hits home a lot of the times. Someone always knows someone who has cancer, or just seeing patients in front of you that unfortunately are not making it. So you do have to have a passion for your field to really go day by day and go back and help these patients. Yes, so there's definitely a demand for hem-onc pharmacists in general. Right now, the market is 2 to 1, so there's 2 positions available for every 1 hematology-oncology pharmacist. And that's because infusion centers as well as hospitals are starting to realize how toxic the chemotherapy is, and how much you need to educate patients, monitor patients, and just in general, cancer cases are rising throughout the United States.
What about general pharmacy?
So general pharmacy right now, retail, I would say, is pretty saturated, and the working conditions are not as great. So people are trying to shift into hospital positions. It's still a fair market, I would say. I don't think it's too saturated at this point, but it's always like waxing and waning. So I think more people are shifting to pharma for that quality of life, or the hospital, and leaving retail, but there are always positions available.
What do you love about your job, and what's something that you hate about it, or dislike? Maybe hate's a strong word.
So I love that I can really take the time to connect with my patients. So I don't have like a quota where I have to meet or a certain time where I can only sit with patients. My day is very flexible, where if a patient and a family member needs an hour of education and I need to keep re-educating them, I have that time to spend with them. So I really enjoy having that time with patients. Something I dislike, and I think is just something you have to work through, is I had to build kind of like a wall with your patients, because a lot of them, it becomes really personal when you're seeing them for multiple years, battling them with them through their cancer, giving them different treatments, and their families are there as well. So you do have a lot of really emotional days, hearing about patients passing or not doing well. So I think that is the hardest. Those are the hardest days I have, really. But that's where the passion kicks in to keep going back. Yeah, so one, I think cancer is just a subject that everyone has a relationship with. So whether you know someone who has cancer, you heard of a friend who has cancer. So just being able to be a resource. So I get so many calls just like from friends or family members about a new diagnosis or what to do. So using just like our community to be a resource for them. Giving like talks about cancer screening is something that I'm passionate about. Another thing I really enjoy doing, and one of my mentors actually told me to do, is when you walk into a patient room, you pray for them. And I think that's really important, because especially with oncology cases, patients are going through the worst time of their lives at that moment when they're getting a diagnosis or their family is hearing of the diagnosis. So really saying a prayer for them is important. And it just gives me comfort that I know, I'll do my best, but at the end of the day, God is the one that's going to heal or make his decision.
To change topic just a little bit, what's an expected salary for, a traditional pharmacist? And if you can, specifically for your field?
Yeah. So when you come out of pharmacy school, the expectation is that you will get 110 to 120 off the bat.
Yeah.
As you go deeper and you specialize, you will actually make upwards of 130 to 150, as well as in fellowship, it ends up being about the same. And then you can specialize further, and as you grow it, you can get upwards to 200. Lots of variability because of the roles that you can do as a pharmacist. Yeah. And you're also not limited. So if you do clinical, you can switch to fellowship. If you do retail, you can switch to hospital. So there's a lot of movement in the career. So that makes it awesome as well.
That's awesome. Great. Thanks so much for being here.
Thank you.
Appreciate it. We'll see you on another episode of Aspirations. Bye, everyone.